I've been interested in augmented reality for a long time, and HipInsight is the first platform for augmented reality that puts the 3D model directly on the patient. So you have essentially X-ray vision.
As we're learning more and more about what are the complications associated with failures of arthroplasty, the second most common reason is actually dislocation and stability. And so if we're going to move that needle, cup placement has to be better.
Proper cup position gives us more stable hips, and HipInsight gets you there every single time.
The addition of augmented reality opens up a lot more possibilities. The goggles don't get fooled by a malpositioned patient.
We'll get the plan on the front end, and we're able to evaluate the patient's anatomy.
HipInsight will plan the positioning for you, whether that cup needs to be positioned with increased anteversion or decreased anteversion, increased abduction or decreased. That work is already done. Sizing is also taken care of.
I'll make my approach and then register the pelvis, which we do with the HipInsight tool. Registering the pelvis will let the HoloLens know where the anatomy is in real life.
And when I'm ready to do the implantation, they will apply the HoloLens on me, and you simply go through hologram 1, hologram 2 with your voice. You're actually visualizing the patient's anatomy. You're not looking at a computer screen, you're looking at the patient.
You skip a step on synthesizing information. You don't have to look at a CT scan and think about what is this going to look like intraoperatively? Where are these defects going to be? Instead of having to go through that whole process, you can see it in the operating room. That is truly augmented reality.
To be immersed into the technology yourself, it's pretty amazing.
We're living in a world where cost constraint is a real deal. The federal government, the state government, our patients, they want us to be taking the best care of them, but they also want us to control expenses. This fits right into that paradigm. And it's so different, right? That's what's so unique about it. It's so different than anything else out there. You know, there's nobody else who's in this space doing this type of technology at this level yet. I mean, it's tomorrow's medicine today.
For me and my workflow, this is a seamless integration into my normal procedure where I don't have to bring a big robot in. I don't have to worry about my assistants in the way of the arrays to register the pelvis.
HipInsight is cost effective. It doesn't take a significant amount of time to register the patient, 3 to 5 minutes, and ultimately in certain cases it'll save you much more than that if you recognize intraoperative instability and you have to reposition that component, that this will prevent that.
Whereas before we were using trials intraoperatively and then getting an intraoperative x-ray, and then we would have to go back and re-expose to put in final implants. We go straight to final implants.
In all essence, it's a robotic plan. It's a CAT scan based plan, but you're doing the surgery. You don't have a big clunky machine next to you fighting position with your assistants or yourself. You're actually doing the surgery, you're immersed into it.
I think the first outcome difference you'll see is how you feel about the case afterwards when you see the x-rays, and the x-rays are perfect every time. Especially on complex cases, feel a lot more confident where you put the implants, and as a result, as a surgeon, you sleep better at night.
My favorite thing is just knowing for sure that the cup's right where I planned it. We shoot for perfect every time, and this sort of gives us a much better chance to get that.
Once you've experienced it, it's almost like you don't want to ever do the surgery without HipInsight.